Hello and welcome to Legal Links, a legal information program brought to you by the Oregon State Bar. My name is Paul Nichols. I'm the editor of the Oregon State Bar Bulletin and your host for today's program. Today we will be discussing Medicare and Medicare fraud. With me to discuss these topics are Janae Haas and Claudia Grimm. Janae is an Oregon lawyer and legal services developer for older Oregonians. She has devoted her career to legal services for low-income people and is an active volunteer with the bar's public outreach programs. Claudia is the coordinator of Oregon's Senior Health Insurance Benefits Assistance Program. Welcome to you both.
Thank you, Paul. Thanks.
My first question is, what is Medicare? Let's define that. And how does it differ from Medicaid?
Let me start with Medicaid, because in Oregon, that's known as the Oregon Health Plan, and it is probably sort of the best known of the two. It covers folks who have very low incomes and hardly any assets for a broad range of medical needs. It is free to those people for the most part. Medicare, on the other hand, is for particular populations, and we mostly think of it in regard to older people. It's available to most Americans over age 65. It's also available to people who have permanent and total disabilities and to folks who have end-renal stage kidney problems.
Is one more viewed as a state program, as a federal program?
They're both federally funded, but the state administers the Medicaid program.
Okay. In this program, Medicare, what kind of medical expenses does it cover?
It depends on the part of Medicare coverage that a person has. Historically, we've had Part A and B, and Part A covered hospital, hospice care, rehabilitation services in nursing home facilities and hospitals. It has also come to cover home health care in some areas. And then there is Part B that we think of as the doctor's part of the services for Medicare. And those services cover not only doctor care, some rehabilitation services, also some home health services. And for all of these, for these two kinds of services, people do pay deductibles and co-payments and premiums to some extent.
Well, that leads to my next question. Who pays for this?
The government pays for most of this, and individuals pay either directly through co-payments, deductibles, and premiums, or in the case of original Medicare hospitalization, they have paid for it pretty much all their lives through their paychecks. There's a couple of other kinds of Medicare that are newer. One is what's called Medicare Advantage or Medicare Plus Choice, which is the HMO model of Medicare. So someone goes to a Kaiser kind of place, for example, and can get the combined hospital and doctor services. And then Claudia will talk a little bit about the newest aspect of Medicare, which is prescription coverage.
And that, you were again leading into my next question. There's been a lot in the news recently about prescription benefit changes. And how does that new benefit work?
Well, the new benefit is a prescription drug benefit that's available to everybody who has Medicare A and or Medicare B. So anyone who is 65 and older or on Medicare because they have a disability younger than 65 years of age is eligible for the new prescription drug program. And there are many, many choices, which has been overwhelming to a lot of our beneficiaries. So the new aspect of that is that now prescription drugs will be covered by Medicare, and that goes the same with the people who have Medicaid are also being affected by this new change as well. So the folks that Janae deals a lot with, lower income people who previously had prescription drug coverage that was paid for by Medicaid, by the state of Oregon, now are having to transition to the new Medicare prescription drug program.
Is that where your program comes in, the Senior Health Insurance Benefits Assistance Program?
Yes, our program is a network of training train volunteers, and we train volunteers to counsel and work with beneficiaries one-on-one on a wide variety of issues, but more specifically recently Medicare D, the new prescription drug benefit, has eclipsed a lot of the work that we're doing.
I imagine that's taking quite a bit of your time, given the misunderstandings and the learning curve involved with the new program.
Yes.
I want to back up a second. Tell me what about Medigap insurance? We hear that term thrown around. What does it mean and who does it apply to?
Medigap is a supplemental insurance policy. If a person has Medicare A and Medicare B, Medicare will most likely pay for approximately 80% of their hospital or doctor outpatient services. A person with Medicare may also decide to purchase something called a supplemental policy or Medigap, and there are different policies that cover different things. They're lettered A through L in Oregon. That's additional coverage that would cover that 20% that a beneficiary would be responsible for if they didn't have that additional coverage.
Are you telling me this program varies from state to state?
What Medicare covers doesn't vary from state to state. The Medigap policies the Medigap supplemental policies may vary from state to state.
Very good. Let's talk a little bit about Medicare fraud. Sometimes that gets thrown around. Is there much of it? What is it?
There's lots. If we were to define it, we'd say it is simply stealing Medicare money, both from the government and from individuals who have Medicare, by lying, by pretending to provide services that you don't provide, or falsifying bills for Medicare and so on. It's a pretty big industry, actually. This
who's
last
perpetrating
year,
this fraud?
everybody. No. We see it everywhere, actually.
Providers or clients or both? Or?
A very small extent clients, to some extent their caregivers, their family members, lots of medical practices, hospice care, home health care. There have been convictions in Oregon of just about everybody you could imagine: hospitals, doctors, nursing homes.
Mm-hmm. What's the effect on the system? Who pays the price for that?
Well, the price gets paid in a couple of ways. Indirectly, it comes out of every one of our paychecks. You know, the little FICA symbol there that says a couple of our dollars have been sent to Medicare. Some percentage of that money that we have worked for is being taken by crooks. For the people who actually get Medicare, those folks are paying in addition out of pocket. Claudia was just describing that gap, that 20% that Medicare doesn't cover. If Medicare has paid someone for a service that this person never got, the person is going to get a bill for the rest of the money that someone claims is owed, and that is for a service the person never got. And people do pay these things out of their pockets and out of their Social Security money.
So we have good reason, all of us, to care about the fraud, because it affects what we pay. I hear when you say it affects what we pay and affects the amount of services that can be provided.
Absolutely.
Mm-hmm. Well, I've already asked you this question about who commits those, so I'll skip that. Let's discuss how the situation of Medicare fraud here in Oregon. Is it serious?
It is as common in Oregon as it is anywhere else in the country. CMS, the Center for Medicare and Medicaid Services, estimates that about $12 billion was stolen of Medicare payments last year. And that actually is down from previous years because of better enforcement and better public education. But we've certainly seen in the paper and on the news situations where there has been serious fraud. I understand that just this week the federal government descended on a group of clinics in Lane County and absconded with people's records because a clinic organization is being charged with falsifying billings. A couple of years ago, there was a psychotherapist in Oregon who made the headlines for doing what the papers called wave therapy, that he would go to visit people who were in facilities, he'd stick his head in the door of each room and say, "Hello, Mrs. Jones. Hello, Mrs. Wilson," and then go back to his office and send out bills for having provided therapeutic services. I understand that he now has a bill for about $2 million that he owes to the state of Oregon.
Good work if you can get it and if it were legal. So seniors should be worried about fraud in the prescription drug program. Should they be?
You think so?
There are some red flags and warnings that I'd like to provide for viewers who may be watching, and I predicate what I'm saying at the time of this taping. We're still enrolling people, so my words of advice is it doesn't, if someone is enrolling a senior, doing it on their behalf, they do not need to disclose their bank statement information. They do not need to disclose their credit card information. Signing up for the new program on the internet does not require disclosing any personal credit history, bank information, financial information, unless, of course, you're working with someone from Social Security for the low-income subsidy, which we'll get into that a little bit later. There have been some cases of people knocking on doors, going door to door in different communities, and Bend is an example where they say, for $200, I'll sign you up for the program. So I would encourage seniors that if they're working with an agent, insurance agent, have it be someone that they know and trust and have worked with, and know that person's reputation, because it doesn't cost people money to use the Medicare.gov web tool to sign up for the new prescription benefit.
The website, your medical provider, who else, your insurance agent, who else should you trust to enroll in this program?
Well, our program, the Senior Health Insurance Benefit Assistance Program, is a program of trained volunteers, and we provide unbiased counseling and education to beneficiaries. People can reach us by calling an 800 number that I believe will be displayed on the screen at the end of the show. And they can come to us for advice and guidance, and we don't try to steer people to a particular plan, but instead we look at the drugs that they're taking, their unique medications that they're taking for their personal health, and we look at their health history, and we make a recommendation based on the prescriptions they're taking.
It's like tailoring an outfit, different for each individual.
Exactly, Paul. Your prescription is going to be different than, your plan may be different than your wife or your spouse's or your mom's or your dad's. It really depends on the drugs you're taking and what coverage, Medicare, Medicaid, any of the supplementals or the Medicare Advantage that Janae talked about, anything else that you currently have.
I want to go back to that, who do you trust? It's a very complicated program. I have to say that even I don't understand it, and I'm glad I don't have to explain it to senior relatives.
Sure.
But what are, on the flip side, what are some other red flags, people you might not want to necessarily trust in enrolling in this program? What have you seen?
I would say we get a lot of reports from seniors who feel pressured to take a certain plan. You need to sign up for this plan. If a senior or a person on Medicare is feeling pressured, is getting that kind of, they're not ready to make a decision, but here's someone who really wants them to decide, people have until May 15th, 2006 to sign up for this program. So if you're feeling unduly pressured, I would say stop the conversation and call us at our 1-800 number, call Janae to file a report of someone who may be acting unscrupulously.
Now you operate out of Salem, is that correct? You're part of the Department of Consumer...
Yes, our main office is in Salem, and if people call our 800 number, that's where they'll be calling to. We also have 23 local offices in Oregon, in the different counties that serve one or multiple counties, and people can go to their local SHIBA program for assistance as well.
So in addition to SHIBA, the Senior Health Insurance Benefits Assistance Program, what else is there?
For assistance with helping people.
Well, and Medicare in general.
We are the Medicare. We are the place to go for assistance with Medicare. We're free. We counsel people free of charge. We can help with billing errors. If people feel like they're being a victim in some way of fraud and abuse with regard to the Medicare program, they can call our 800 number for help.
Okay, very good. Now,
there's also another resource for folks who have problems with Medicare. Medicare not only inadvertently pays people who aren't entitled to the money, It also underpays people who are entitled to the money. And so sometimes seniors will see that a bona fide claim for Medicare coverage has been denied. And in that case, they should be talking to a lawyer who's familiar with Medicare.
And to do that, they can go to the lawyer referral service of the Oregon State Bar, and that's on our website. And that would be a very good way to go. I want to go back to this May 15th deadline that you referred to. Not to date this program, but we are filming it on the last day of February in 2006. People are rushing to meet that deadline. What happens if they don't make that deadline?
If people are eligible or receiving Medicare A and or B and do not have what's called creditable prescription drug coverage, that means drug coverage that's as good as or better provided by an employer or some retiree benefit. If they wait past May 15th and decide, some people are making the decision not to do anything because that's their choice. They're making an informed decision not to do anything, but there will be a penalty. And that penalty at this date is set at 1% per month, and it will accumulate until a person decides to enroll. So it will accumulate from the May 15th, 2006 for the number of months until a person decides to enroll, and then that percentage will be attached every month to their monthly premium.
To the end of time? I mean,
yes.
100%?
Yes.
Okay, so there's a real good incentive to sign up by, well, soon.
Yes, yes.
Now, let's talk about where should people go to report fraud, waste, and abuse in the Medicare and Medicaid systems?
Well, Claudia mentioned one resource, which is the SHIBA program. There is actually an organization in Oregon now called the Senior Medicare Patrol, which is particularly interested in hearing about abuse, fraud, and waste in Medicare. And we have I was going to say an 800 number, but it's really an 888 number. Fraud 01, 888 FRAUD 01, about Medicare and Medicaid fraud. That is a statewide number that people can report any irregularity in the payment structure or what seems to be going on with the different providers in the state.
Now, you've been at this a while. What kind of things do you see when people report?
One thing that we see fairly frequently is what they call unbundling, where a provider might have a reason to see you one time, but breaks up the visit into 3 or 4 separate visits so that they can bill Medicare for 4 visits instead of 1 visit. That's a very common one. Another common one is that people will rent durable medical equipment, wheelchairs, hospital beds for their own homes, and then when they don't need them anymore, the equipment provider won't come around to pick up the equipment, because the longer the equipment is there, the longer the provider can bill Medicare.
What kind of trends do you see in your program?
With the new prescription drug benefit, it's a hard one to say because it's still so new. It's only been in effect essentially for 2 months, since January 1st. Right now the issues are more of people not being able to get their prescriptions filled. The insurance companies don't have a record of someone who has said that they've signed up, so they're unable to purchase the drugs that they need. In many cases, or in some cases, life-saving medication. So those are the kinds of issues that we've run into since January, since the first day of implementation of this program.
How are things going to change for you in May when things flip over? Are you going to be addressing a different set of problems and questions?
I anticipate that we'll be dealing a lot with appeals, people who signed up for a plan, the plan's changed either their formulary since the date the person has signed up, and now they can't get needed drug that they thought they were going to be covered for when they signed up, or someone whose health condition may change since the time that they have signed up for a plan and now they need a new medication. I think we'll be doing a lot of appeals, working with doctors and the drug companies to get people the medications that they need.
Do you have a sense of whether more people are being covered and whether it's easier for them, or whether they're even saving any money? Do you have any sense of that?
Yes, and I would say, as much as people like to knock the program because it's confusing, and it is, that when people are able to get the drugs they need, they're going to save money. They won't see it till they meet their monthly deductible, or their deductible that they have for their plan. But when we do the calculations, sit down with our clients and our customers, we see that they will save money once they meet that deductible. So I think it will help a lot of people who could not otherwise afford medications, or who in some cases were splitting pills to get by, not taking the dosage that they need to stay healthy.
Oh, very good. What's on the horizon in your program? I'm trying to get you to tell me what the trends are.
I'm expecting that we'll be working very closely with Claudia. When I say we, I mean the Senior Medicare Patrol, because one of the things that we're doing is educating caregivers and family members about potential Medicare fraud issues. And I'm also involved in training lawyers throughout Oregon to recognize and to be able to respond to some of the Medicare denial issues and some of the Medicare fraud issues as well. So those will be ongoing.
Well, for our attorney viewers, how do they connect with that program?
With the Senior Medicare Patrol?
Yeah, right.
They can actually reach me at my office at 503-945-8999 in Salem, and of course that's listed in the bar bulletin, or the bar book, I'm sorry, the directory as well.
Very good. We've got about 4 minutes, so I'm going to open this up to any topics that you felt like we left uncovered.
Do you want to talk about the low-income subsidy?
There is extra help for seniors with limited incomes, and that would be below 150% of the federal poverty level. Social Security does offer various tiers or levels of assistance, and in some cases, depending on what a beneficiary would qualify for, would not have to pay premiums, would not have to meet a deductible, and would have between a $2 and $5 copay. And people could go into their local Social Security office and find out if that's an option for them to help with their costs of the new prescription drug program.
And I'd like to add that for people who are experiencing difficulty getting their prescriptions because there don't seem to be any records anywhere, that at least for people who are eligible for the low-income subsidies, or for people who are already getting services from the Oregon Department of Human Services, those folks can go directly to their local Senior and People with Disabilities office. Staff there are trained to intervene and try to help folks get the meds that they need. And if it can't be done at the local level, there are people in the central office in Salem now who do nothing but contact CMS and the plans and the pharmacies to try to work out issues for folks.
CMS being?
The Center for Medicare and Medicaid Services. Okay. We want to tell folks that there are some significant computer problems currently that are probably going to last for several months.
Is this what you were referring to a moment ago when you said a lack of records?
Yes, actually.
Well,
so
discuss that for a moment.
Well, the center can't figure out how to get this information to the pharmacies quickly enough so that folks can actually have accurate records when they show up and ask for their meds. And there is a glitch in the system that is going to recur for a lot of people over the next several months. And they need to know that if they are turned down when they think they have coverage, that they should either be talking to the SHIBA program, or if they are already getting services through the Department of Human Services, to go back to their office and let them know so that they can get the meds they need.
Okay, good. Any parting thoughts? What would you like people to go away with after watching this program today? What's the essential idea you want to impart?
Well, I would like lawyers to participate in helping people with their Medicare denials and other billing-related issues, and Claudia has other ideas.
I just want to let people know that, Paul, that there's help out there, unbiased help that's free and available to anyone. A lot of people call on behalf of their elderly parents, but there is help out there in making this very important decision, which, as we talked about, if it's not made, there would be a financial repercussion. So there is help out there, and it's free by educated people.
Oh, very good. That's good information from you both, and thank you for being here. Well, that's all we have time for today. We thank you, Claudia and Janae, and we appreciate your helping us today by providing information about Medicare. More information about this subject and others is available to you online. Just visit the Oregon State Bar's website, www.osbar.org. The website contains a wide array of information on legal topics, and while you're there, you can comment on this program and give us suggestions for future programs. I hope you have found this program helpful and informative. On behalf of the Oregon State Bar, I thank you for joining us, and I hope to see you next time on Legal Links.